If your A1C is over 5.7 and you've experienced any nerve symptoms such as numbness, pain, or tingling, this post is for you. Peripheral neuropathy isn't random, and this post is going to explain why. Nerves use a glucose transporter called a GLUT3 transporter, which allows the cells to bring in glucose without needing insulin. So when your blood sugar is high, these cells tend to get overexposed. Whenever you have overexposure of glucose can be pushed into pathways that are built to handle the excess. In many different cell types, when there is excess glucose, some of that glucose can be converted into sorbitol using an enzyme called aldose reductase. The problem in nerves is that they can't convert sorbitol to fructose very well because they have limited amounts of this enzyme, sorbitol dehydrogenase. This is going to lead to a buildup of sorbitol. In nerves, this is going to attract water and cause osmotic pressure. In nerves, that excess osmotic pressure is bad because that cell starts to swell, and that swelling causes problems with nerve conduction and the vascularization of the cell, i.e. the blood vessels that feed the cell. How does this connect to fat loss? Chronically high sugar is going to mean chronically high insulin. Chronically high insulin is going to lead to insulin resistance. Insulin resistance is going to mean that you're going to have trouble losing fat, and because you're insulin resistant, you can't bring in sugar into the cell, so it's going to stay circulating in the blood, and if it stays circulating in the blood, it's going to end up in places that can't stop bringing sugar in, such as the nerves that have the GLUT3 transporters, which is going to lead to things such as peripheral neuropathy, at least down the road. But this is why it's very important to get that blood sugar down through doing resistance exercise. So if your A1C is over 5.7 and you're struggling with fat loss, you can go ahead and send me a DM via IG or TikTok, or you can click the link in my bio for a 30-minute complimentary consult. I'll see you all in the next one.